Varicose veins is common condition. It affects around 25% of adult population globally. Varicose veins may seem superficial and aesthetic problem, but its underlying mechanism is more serious, and it can increase risk of venous stasis ulcers, deep vein thrombosis, and pulmonary embolism. For example, it can increase risk of deep vein thrombosis 5 times. So it's important to focus on potential risks of varicose veins. Varicose veins usually develop on legs, so on lower extremities, but it also can develop on esophagus, which is called esophageal varices. You can see on the image. Also on testicular region, which is called varicocele, and on uterus in women, which is called pelvic varicose veins in women. We focus on varicose veins on legs, and we have 3 types of varicose veins. First and most common type is trunk varicose veins. You can see on the picture here, it's large, narrowed, and bulging appearance of veins on the leg. It's trunk varicose veins. Second type is reticular varicose veins. You can see it's much more smaller, red or blue, and located closer to the skin. It's just underlying skin surface. Third type is called telangiectasia or spider veins. Both are same condition, and they are smaller, red or blue lines. You can see here blue lines and red lines here. That's spider veins. Mechanism of action of varicoses is increased venous pressure. It's important factor, and valve dysfunction. Normally this valve should be one-way direct, and it should direct blood upward direction. But when there is valve dysfunction, it can't direct blood in one direction, so there is blood pool and increased blood pressure. Also, genetics plays roles. Genetics, especially content of collagen and elastin in blood vessels, is important. That's why genetic plays important role. And risk factors. What is risk factors? Risk factors of varicosis is prolonged standing or sitting, obesity, sedentary lifestyle, age. Risk of varicosis increases with age and female sex. Now let's say varicose vein symptoms. Visually we have dilated, twisted veins which are visible under the skin. You can notice here, often resembling ropes or worms. These veins may appear bluish or dark purple. Leg pain is common, heaviness, swelling of the leg due to blood accumulation, itching also because of blood pooling and accumulation, changed skin color, particularly around the ankle. Mild leg cramps is common during the night, and restless leg syndrome. Also, sometimes easy bleeding from varicose veins happens, and bleeding sometimes can be serious, but such cases are rare. Diagnosis happens usually inspection, and gold standard of diagnosis is duplex ultrasound. On duplex ultrasound we can see venous insufficiency. You can see here when we said when valve insufficiency, this is valve. When this valve is not functioning well, its function is to direct blood upward, but instead of upward, it directs blood downward also when there is insufficiency. That's why venous varicosis occurs. And what is treatment? Conservative treatment or first line treatment is compression stockings, weight loss, avoiding long periods of standing or sitting. If this lifestyle modifications and compression stockings is not enough, then endovenous laser treatment is common. Radiofrequency ablation is common treatment. Especially this tool is considered gold standard because high effectiveness and less side effects, or sclerotherapy. Also, if there is serious conditions and is not managed by less invasive methods, surgery is indicated. It's stripping or phlebotomy. That's all I wanted to say about venous varicosis. Thank you for your interest. Thank you for your watching. If you like my videos, please thumbs up. If you like my channel, please subscribe. Thank you very much. Bye for now.